Ahoy! Today is August the 7th, so it's a it's a Wednesday, and today I had an appointment at Ipswich Hospital with Dr. Hilger and Dr. Scrace, who are my ENT and my oncologist respectively. As well, in that particular meeting we had was a nurse who is a chemotherapy nurse and also a speech therapist. So we discussed the fact that Dr. Scrace over the weekend has been working on my case, which is very kind of him. He didn't need to do that, but he did anyway. So he's done all the calculations, and he's also spoken to my nephrologist about my kidneys. So they've made a joint decision that I can take the full hammer of the chemotherapy. So we're going to go with the rather more gruesome approach of cisplatin. I think that's what it's called, cisplatin chemotherapy, once a week during my radiotherapy, which will be every day. So there's a second sort of set of forms and things to go through with regards to what that will mean for me. The plan is to start that on week commencing the 19th at the very latest. So there's a possibility that we're able to start that earlier, and if we can, we will. I think that the hold up is more the logistics on their side, in particular with relation to the fact that they're going to have every time I'm getting radiotherapy and having the CT scan, they're going to have a cardio team on standby to monitor my my vitals while my ICD is turned off. Not that really I think there's any risk, but it's really proper belt and braces, really. So having spoken with the oncologist, we were still waiting for the MRI to be scheduled. It's not necessary, but it is sort of better practice to have the MRI there. It allows them to sort of tie all the pieces together with the CT scans and the PET scans that I've had, just to join it all together. They're also waiting for the PET scan imagery to come through. So apparently, while the report has come through quite quickly, the images from the PET scan are taking a little time, and Dr. Scrace needs that just to sort of finalise some of the details of the therapy that I will receive. What else is there? So once Dr. Scrace and Dr. Hilger had left the room, I was handed over to talk about the chemotherapy that will be happening, and again, they can't do very much until they've really sort of finalised on what type of chemotherapy I'm going to have, but more importantly what date we're going to start. So there was nothing really to sign, just to sort of say that actually we're going to be there was the option of just focusing on one tonsil on the right side, but actually we're going to go for both. We're going to give a slightly lower dose on the left hand side than on the right, but we are going to give both, just to make sure we've covered all possibilities in terms of where the cancer cells might be. So that will be the approach for that. Then during that meeting, Papworth Hospital called and they said, we've got an opportunity for you to have your MRI on the 15th. So I have an appointment at Papworth Hospital at 11:30 in the morning on the 15th, which is a Thursday of next week. That might collide with the radiotherapy if we've started by then, or the chemotherapy. We'll shuffle things around. I'm sure that shouldn't be too much of a problem. And also then saw the speech therapist, who kind of doubles up a bit as a sort of swallowing therapist, because of the area of the neck that they're going to be irradiating. The cells and muscles in that region will start to tighten up, and so we need to try and keep the muscles in my mouth and the muscles in my throat as effective as they can be. So I've been given some exercises. One is to pinch my tongue between my teeth and then swallow, and I have to do that 7 times in a row, 3 times a day. There are a number of other exercises, including sort of the lateral motion of the jaw, and also opening the mouth in sort of a meow sort of kind of motion to try and keep it open. 6 centimeters is the sort of distance between my lower tooth and my upper tooth, and so we've now got sort of set a bar in terms of what I'm capable of opening my mouth, and we have to try and keep my mouth and my throat sort of exercised in that way, both before and then during the treatment. It is very probable I'll lose the ability to swallow and eat. It'll become too sore and my saliva glands will start shutting down. And so we're also going to be talking with Dr. Mew very shortly about fitting me with a feeding tube. So that feeding tube will go into the side of my stomach and will allow nutrients to be injected into my stomach without me needing to eat or swallow. There is a possibility that I continue to be able to do the eating and swallowing, but we need to have the backup. So I believe the intention is to have that fitted before radiotherapy starts, but in practice that may not happen, and I might need to have it fitted after we've started the therapies. Anything else? I had my teeth checked again. They just want to make sure that everything's tickety-boo in terms of the teeth. And that's about it. I'm waiting now for more dates from the chemo team and sort of finalisation of the treatment. I do have another appointment at Papworth on Monday of next week. Actually, that was already in the books anyway. That was to go and check my my ICD. It's a yearly checkup that I have anyway. It was already in there. It's a bit annoying that we're going to have to go up there twice, but c'est la vie. We don't get to choose these things. And in fact, I might actually call Papworth and see if we can cancel that first one, because most of the time when we go up and do an MRI, they do a quick sort of smoke test. Well, not a smoke test, but they test the ICD anyway. So I might call and see if we actually need both appointments, because we kind of do the ICD test as part of the MRI. Anyway, I can work that out. It's a detail. It's not a problem. Work are being really good. A lot of people are saying, why are you even still at work? You can hear my voice is going a bit. I've run a couple of interviews today, and I've run a few sort of debriefs on some of the projects that I'm handing over to other members of the team. It's apparently reasonably normal that I start losing my voice, and in fact my voice may even, subsequent to the treatment, may even be like this ongoing. So it's just something I have to cope with, and hopefully I'll have another update for you. Well, the next one will be sort of ephemerally, maybe later this week. I might be able to give you an update. Maybe they give me some dates of when my treatment will start. The other thing was to say that they will do a PET scan at the end, like 3 months afterwards. They do another PET scan just to see that the lumps on the side of my neck will have begun to disappear or disappeared entirely by then. So they just want to make sure that the cancer cells have actually disappeared. So that's that. Alright, I'll see you next time. Bye bye.